Well, the election's over and the questions still remain the same. What do we do about health care reform? What I'm advising people to do is what they should have been doing 6 months ago, and that's to become educated about health care reform. Depending upon whether you're a consumer or an employer, it's going to impact you differently. So it's vital that you get educated and understand how it's going to impact you individually. There's different ways to do that. There's a lot of information out there, and there certainly was before the election that was politically skewed one way or the other. There's some resources such as healthcare.gov that is basically a neutral site put out by the government, but you should be seeking the assistance of a qualified broker or benefit consultant that's been staying up on healthcare reform, because they're going to have the most up-to-date information. We try to provide our clients information prior to deadlines that are coming out. It's important that you know these things at least 60 to 90 days ahead so that you can prepare to distribute that information if that's what's required to your employees and stay ahead of the game. So, my answer once again to everybody is you need to get educated, understand how it's going to affect you, whether it be an individual or an employer. Work with a qualified consultant or broker, understand how it's going to impact you and your business, your family, those around you. Start making the necessary changes, because it is going to continue to move forward. The next deadline that we see is, now that the presidential race is over, is the states will have to notify the federal government of their plan to initiate a state exchange or use the federal exchange. Following that, in March of 2013, employers will be required to notify their staff of their right to coverage through the exchanges. And throughout 2013, we'll continue to prepare for the rollout and the final implementation in January of 2014 of a lot of the healthcare initiatives. So it's important that you see where you're at, work with someone to make sure that you're compliant, that you get the assistance that you need to prevent any unnecessary penalties that you may face, and make the necessary changes to your benefits and plan. So that's your healthcare moment for today. This is Gary Thompson with Chapel Smith & Associates.